Good evening, very good evening to one and all. It's me, Abhilash Vijay Mohanan, again on this virtual platform from B-GHUD Academy. അപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നു, സമാധാനമായിട്ടിരിക്കുന്നു, ആരോഗ്യമായിട്ടിരിക്കുന്നു എന്നൊക്കെ വിചാരിക്കുന്നു. അപ്പോൾ നമ്മുടെ 16th ലൈവ് പെർഫോമൻസ് അല്ലെങ്കിൽ ലൈവ് പ്ലാറ്റ്ഫോം വെർച്വൽ പ്ലാറ്റ്ഫോം ക്ലാസ്സിലേക്ക് നമ്മൾ കടക്കുകയാണ്. So I'm very happy that many of our students are sending me messages like they all are making use of our classes. അപ്പോൾ നമ്മുടെ ക്ലാസ്സുകളൊക്കെ വളരെ സന്തോഷമാവുന്നുണ്ട്, എല്ലാവർക്കും വളരെ യൂസ്ഫുൾ ആവുന്നുണ്ട് എന്ന് പലരും വിളിച്ച് പറയുന്നുണ്ട്. അപ്പോൾ നമുക്ക് ഏറ്റവും വലിയ സന്തോഷം എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ നമ്മുടെ കുട്ടികൾ ഇതെല്ലാം നമ്മുടെ ക്ലാസ്സുകളെല്ലാം ഇവരെന്ത് ചെയ്യുന്നു, ഇവർ യൂസ് ചെയ്യുന്നു എന്നുള്ളത് തന്നെയാണ് നമുക്ക് ഏറ്റവും വലിയ സന്തോഷം. സോ ഐ വാണ്ട് ഓൾ ഓഫ് യു ടു വാച്ച് ദീസ് ലൈവ് ക്ലാസ്സസ്, മേക്ക് യൂസ് ഓഫ് ദീസ് ക്lasses. Okay, and I want you to subscribe this. Okay, please do like it, do comment this, pin your suggestions over here and share it among your friends, those who aspire to be there in an English speaking country. Okay, sort of participation. I want all of you to come up with your participation now. So anyway, very good evening to one and all. I want all of you to support us like this. Okay, അപ്പോൾ എല്ലാവരും നമ്മുടെ ക്ലാസ്സുകൾ കാണുക, അത് നിങ്ങളുടെ ഫ്രണ്ട്സിനും മറ്റുള്ളവർക്കുമായിട്ട് ഷെയർ ചെയ്ത് കൊടുക്കുക. എന്താണ് നമ്മുടെ ക്ലാസ്സുകളെക്കുറിച്ച് കൂടുതലായിട്ടുള്ള നിങ്ങൾക്കുള്ള സജഷൻസ് നമുക്ക് അയച്ചു തരിക. സോ ദാറ്റ് വിൽ ബി ഏബിൾ ടു പെർഫോം മോർ ഫ്രൂട്ട്ഫുള്ളി. ഓക്കെ, സോ അപ്പോൾ നമുക്ക് അങ്ങനെ വരുമ്പോഴത്തേക്ക് നമുക്ക് നമ്മുടെ ക്ലാസ്സുകൾ കൂടുതലും യൂസ്ഫുൾ ആയിട്ട് ഇരുത്താനായിട്ട് നമുക്ക് പറ്റുന്നതായിരിക്കും. So I just want my friends to come here, just operate this phone for me. Okay, so now I would like to thank, as usual, I would like to thank to all my dear colleagues, those who work with me, Mr. Jobin, Mr. Vipin and even my Joyson, for making this session possible. Okay, without them this wouldn't happen. Okay, I'm really deeply indebted to all my dear friends who are working with me to make this session possible. Okay, so I would like to thank on behalf of you all. Okay, hats off to my crews. Yes, so I thank you Jobin for making this session possible. Okay, hello Bonnie, hello Mercy and Vijay Lakshmi, all of you, very good evening, very good evening. Okay, but throughout this class I want all of you to support me. I just don't want you to come up with answers, but in midst if you come with some sort of emoji, some thumbs up or some actions or some comments, means that would be really a piece of appreciation for me, that could appreciate me, that could entertain me, and I will be more enthusiastic, okay, in this presentation. അപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നു ഒന്നുകൂടെ വിചാരിക്കുന്നു. അപ്പോൾ നമ്മൾ നമ്മുടെ ക്ലാസ്സിലേക്ക് പോകാൻ സമയമൊന്നും കളയേണ്ട ആവശ്യമില്ല. ഓക്കെ, അപ്പോൾ നമുക്ക് ആൻഡ് ഐ വോണ്ട് ടു ഇൻഫോം യു ദറ്റ് വി ആർ ബ്ലെസ്ഡ് വിത്ത് റിസൾട്ട്സ് ഇൻ അബൻഡൻസ്. ഓക്കെ, വി ഹാവ് ഗോട്ട് മച്ച് റിസൾട്ട്സ്. ഇഷ്ടം പോലെ നമ്മുടെ പാസ് പെർസെൻറ്റേജ് എന്ന് പറഞ്ഞാൽ ഓൾമോസ്റ്റ് 100% പാസ് പെർസെൻറ്റേജ് ആണ്. നമ്മുടെ സ്റ്റുഡൻസ് എല്ലാം നല്ല എക്സലൻറ്റ് റിസൾട്ട്സുമായിട്ട് മുമ്പോട്ട് വരുന്നു. ഈവൻ മെനി ആർ ക്രോസിംഗ് above 400 for their speaking sessions and also I'm very proud of my students, those who have fetched us good results and made us very proud by B-GHUD's name more popular and in fame. Okay, B-GHUDിൻ്റെ പേര് വളരെ ഫേമസ് ആക്കിയതിലും B-GHUDിന് പ്രൗഡ് മൊമെൻറ്റ്സ് സമ്മാനിച്ച എല്ലാ സ്റ്റുഡൻസിനും നമ്മൾ അവരെ കൺഗ്രാജുലേറ്റ് ചെയ്യുന്നു. ഓക്കെ, സോ ലെറ്റ് us സ്റ്റാർട്ട് വിത്ത് അവർ ടോപ്പിക് ടുഡേ. സോ അപ്പോൾ ഇന്ന് നമ്മുടെ കമൻറ്റിൽ വന്നിരിക്കുന്നത് സർ സം ഹൗ ടു acknowledge the feelings of a patient. Okay, how to acknowledge, what all are certain structures or sentence structures or some words by which we could validate or acknowledge the patient's expressions. Okay, if the patient is saying something, so we need to tell something in return. That means in that same channel we need to tell something in return, that we are acknowledging, we are validating their feelings. Okay, so what are all some phrases or some ways by which we could give some response in accordance with the patient saying. Patient പറയുന്നതിനനുസരിച്ച്, even if, so what are some sayings the patient is saying, oh nurse, I cannot tolerate this, what I will do. Okay, so in that sentence, or nurse, what will I do? Okay, I'm really very anxious. If you get these sort of actions or reactions from patients, some statements should be there to validate or acknowledge their feelings. So what are all the things? Anyone has got any idea? Means please do comment here. നിങ്ങളൊന്ന് കമൻറ്റ് ചെയ്താൽ എനിക്ക് വളരെ സന്തോഷമായിരിക്കും. ഒന്ന് ഇടാൻ പറ്റുമോ ആർക്കെങ്കിലും? ഒക്കെ ഒന്ന് ഇടാൻ പറ്റുമോ? There are so many students watching on Facebook as well as YouTube. I want any of you to pin your comments over here, so I'll be very grateful and I will be very thankful. I'll be very glad. Okay, ആർക്കെങ്കിലും എന്തെങ്കിലും ഒരു ഐഡിയ ഉണ്ടെങ്കിൽ, how to, if the patient is saying something like, oh nurse, what should I do? I really cannot tolerate, I cannot bear this environment, of all those things, if that comes, means what will be your response, what you can say in return? Okay, that is what I'm asking. Any idea, my dear students? Okay, if the patient is saying something, means simply by an yes, you could make that appreciate. Yes, Martin, I understand. See that power of yes. If your intonation is proper, means if you're good at your tone, if you are able to modulate your tone, means with a simple yes, you could make out, you could appreciate or could validate or you could acknowledge the entire patient's feeling. മക്കളെ ഒരു യെസ് ഉപയോഗിച്ചാൽ തന്നെ പേഷ്യൻ്റ് തകർന്ന് തരിപ്പണമായിട്ടിരിക്കുന്ന സംഭവത്തിൽ ഇപ്പോൾ എന്തെങ്കിലും പേഷ്യൻ്റ് നമ്മളോട് പറയുകയാണെങ്കിൽ നമുക്ക് യെസ്, I got it. Yes, I understand. I know. Okay, I understand. I can understand. Okay, these all are some statements. Hello. Okay, just get me some comments, all of you. Okay, I know how you're feeling. I can understand your worries. I can completely follow your feels. I can completely follow your feels. Okay, I agree. That must have been hard for you. Okay, I can see why you have these concerns. I can see why you have these concerns. Okay, and what else you can say? I understand. I know you are worried. I value your feels. I know why you have these concerns. I understand. Yes, I know. I got it. I got it. So all these things that you can try, these words that you can use, the phrases or some sentences that you can use to validate or acknowledge the expression or the feelings of a patient. Okay, hi Joyson, hello Mane. Okay, so your concerns are understandable. I sense your concerns. I value your concerns. I respect your feels. Okay, I admit your concerns. Okay, I understand. I can understand. I can understand completely. Okay, I know how you are feeling. Okay, so all these things that you can try to validate the patient's feelings or to in order to express. We can express ourselves in return to the patient's actions or reactions. Hope all my dear students are following. Hope all are getting me. So these are certain points that I could give you. Okay, so now this was sent to me by one of our student Prince. Okay, so I hope it is clear to one and all. Ashwati Shaktivel, good morning, good evening Mane, good evening, good evening. I was mistaken. Good evening. Okay, so these are certain. I want all of you to write this and just by heart it. Okay, and according to the situation, when you are doing your individual practice or when you are practicing by self by using a recorder, if you are sitting in flokes, കൂട്ടത്തിലിരുന്ന് നിങ്ങൾ എല്ലാവരും അങ്ങോട്ടും ഇങ്ങോട്ടും പ്രാക്ടീസ് ചെയ്യുവാണെങ്കിൽ you can try all these things so that you can make your communication more novel. Okay, something which is unique, not like cliches or I understand Mary, I understand, I know. Okay, instead of using all those overused phrases, repeated phrases, cliches and all, you can just come up with a good score that will make your speaking more and more attractive. നിങ്ങൾക്ക് വളരെ ഭംഗിയായിട്ട് എന്ത് ചെയ്യാം മക്കളെ, യുണീക്കായിട്ട് വ്യത്യസ്തമായിട്ട് നിങ്ങൾക്ക് എന്ത് ചെയ്യാം, നിങ്ങളുടെ സ്പീക്കിംഗ് പ്രസൻറ്റേഷൻസ് ചെയ്യാൻ പറ്റും. ഓക്കെ, ഐ ഹോപ്പ് this is clear to all, one and all. It's clear all of you? Yes, my dear students? Okay, get me some reactions. Okay, yes. Okay, so many are sending me likes and hearts. Okay, okay, thank you. So now I think I can come to this role play discussion. Now I'll be displaying the question on screen so that we will have an overlook. Together we'll be having an overview. Okay, overlook. We'll be discussing that question. We'll be reading and discussing the question. After that we can go for a presentation and I will give you a role play description. Okay, is that okay for you, all of you? All are ready to watch our role play session? Yes, Jobin, you can place a question there. So now you will get your question on the screen, role play task on screen. Okay, please have a look onto that. Now I will receive your question. Please have a watch on that. Have a look onto it. Yes, your question is right there. Please do have a look onto that, read it carefully, okay, and practice it in your mind. Just scribble that points in your brain or in your mind so that we will have a discussion later. All of you please have a quick look through that. I'll give you 3 minutes so that next I'll go for discussion and we will be going for role play presentation and role play description. Once you finish reading, at least some of you please give me a comment like you have finished reading, okay, so that I can discuss it. I can discuss the questions with you. Once you finish reading, please get me some comments. Okay, I am seeing many students on live platform, that is why I am asking you, okay. Once you finish reading, get me your comment. Okay, no one is there? Okay, so we will come for discussion. Yes, setting is a hospital ward. Okay, so now we'll go for discussion. Yes, setting is a hospital ward. Okay, you are speaking to son or daughter. Okay, depends upon the examiner. You can consider the gender of examiner. On 82-year-old female patient who had bunion surgery 2 weeks ago. The patient will be in son or daughter's care for the 6-month recovery period. Okay, find out how prepared the son or daughter feels about their mother's discharge to their home. Okay, so this is a known case. This can be taken as a known case. Okay, so this is a hospital ward, a known case. Both the patient as well as bystander is known to us. You can collect that bystander's name. Mother's name is not necessary. Okay, it is not fair to collect both the names. Instead, you can call that patient as mother. Okay, on behalf of that son, you can address the patient as mother, since we are talking to the son or daughter. Okay, മക്കളോടാണ് സംസാരിക്കുന്നത്. അതുകൊണ്ട് അമ്മയുടെ പേര് വളരെ നിർബന്ധമല്ല. അവിടെ രണ്ട് പേര് ചോദിക്കുന്നതിനേക്കാട്ടിലും നമുക്ക് ആ ബൈസ്റ്റാൻഡറിൻ്റെ പേര് ചോദിച്ചിട്ട് അമ്മ എന്നുള്ള രീതിയിൽ തന്നെ നമുക്ക് എന്ത് ചെയ്യാം, മക്കളെ അഡ്രസ്സ് ചെയ്തിട്ട് പോകാം. ഓക്കെ, So bunion surgery എന്ന് പറഞ്ഞാൽ മക്കളെ bony foot bump. I think all are aware of that because of some arthritis and all on that big toe side. No, they will be having a deformity, just like a bony bump will be there. It is a deformity, painful deformity near to that big toe. Okay, അവിടെ നമ്മുടെ ബിഗ് ടോയുടെ ഭാഗത്തായിട്ട് ഉണ്ടാകുന്ന ഒരു ബോണി പ്രോമിനൻസ് ആണ് ആർത്രൈറ്റിസും മറ്റു കാര്യങ്ങളും ഒക്കെ ആയിട്ട് ഉണ്ടാകുന്ന ഒരു ഡിഫോമിറ്റിയാണ്, പെയിൻഫുൾ ആയിട്ടുള്ളൊരു ഡിഫോമിറ്റിയാണ്. അതിൻ്റെ സർജിക്കൽ കറക്ഷൻ കഴിഞ്ഞു. ബനിയൻ സർജറി. ഓക്കെ, ബുണിയൻ എന്നൊന്നും കയറി വായിക്കരുത്, ബനിയൻ സർജറി. ഓക്കെ, യെസ്, ദാറ്റ് ഈസ് വാട്ട്. യെസ്, പ്ലീസ് ഡിസ്പ്ലേ ദ ക്വസ്റ്റ്യൻ. Continue with the question because we are okay, since we are continuing with the question. Okay, bunion surgery is done. Okay, it's since 2 weeks the patient is here, so the surgery has got over for past 2 weeks. Okay, it was it is now it's since 2 weeks the patient has completed his surgery. Okay, yes, and okay, and we are now dealing with the patient's care activities. With son or daughter, depends upon the examiner. Okay, we can ask their name, how we can address during that preparation time. So as a son or daughter, you can consider that we are talking with the care activities. For another 6 months, this patient will be under complete care of that സൺ ഓർ ഡോട്ടർ. ഓക്കെ, അപ്പോൾ ഈ 5-6 മാസത്തേക്ക്, അടുത്ത 5-6 മാസത്തേക്ക് എന്താണ്, ഈ അമ്മ ആരുടെ കെയറിലാണ് വരുന്നത്? മകൻ്റെയോ മകളുടെയോ കെയറിലായിരിക്കും ഈ അമ്മ വരുന്നത്. ഓക്കെ, സോ വി ആർ ഗോയിങ് ടു ഡിസ്കസ് ദ തിങ്സ് വിത്ത് ദ that child. Okay, so who is that, whoever it is, son or daughter. Okay, appo nammal we are going to discuss the care activities, find out how prepared the son or daughter feels about mother's discharge. So we can ask about their preparation and their knowledge on how prepared they are, whether they are ready to go back home with their mother. അപ്പോൾ അമ്മ എത്രമാത്രം റെഡിയാണ്, അവർ പ്രിപ്പയർഡ് ആണോ, വീട്ടിലേക്ക് പോയി കണ്ടിന്യൂ ചെയ്യാൻ പ്രിപ്പയർഡ് ആണോ, ആ കാര്യങ്ങളെല്ലാം നമുക്ക് എന്ത് ചെയ്യണം, നമുക്ക് അറിഞ്ഞേ തീരൂ. ഓക്കെ, നെക്സ്റ്റ്, എക്സ്പ്ലെയിൻ ദ മദേഴ്സ് നീഡ് ഫോർ ദ ഫസ്റ്റ് 8 weeks. So what are all the needs? Okay, the most important needs for first 8 weeks that we need to discuss, like non-steroidal anti-inflammatory drugs, painkillers, dressing changes, mobility, personal hygiene, meal preparation. All these things you have to deal in detail. Okay, reassure son or daughter that it is manageable and give advice on strategies which will make caring for their mother easier. Okay, so they may express their anxiety, they may show their lack of knowledge, they may be they will be in panic anxiety, but they will be asking you, they seems to be more concerned. Okay, in that case we can reassure them. Okay, and how to make this care activities more flexible and easy. എത്ര മാത്രം എളുപ്പം അല്ലെങ്കിൽ ഫ്ലെക്സിബിൾ ആയിട്ട് കെയർ ആക്ടിവിറ്റീസ് നമുക്ക് നോക്കാമെന്ന് അവരെ നമ്മൾ അവെയർ ആക്കി കൊടുക്കണം. ഓക്കെ, വി ക്യാൻ സെറ്റപ്പ് എ റുട്ടീൻ, ഗെറ്റിംഗ് മെഡിസിൻ ഓർഗനൈസർ. Okay, ensure she has everything she needs nearby. Okay, so wear a surgical boot. Okay, explain the role of surgical boot. Okay, so what is the role of surgical boot? That means how we can go for this surgical boot. What is the impact of the surgical boot over this surgery? Okay, the surgical area. Yes, yes, that is what that we have to deal with. We have to explain to that son or daughter, whoever it is. Okay, yes. Next one is like explain the role of surgical boot and explain the painkillers and anti-inflammatory drugs. So we can give an idea regarding painkiller and anti-inflammatory drug like naproxen, painkiller anti-inflammatory every 12 hours. Okay, you can give this drug once in every 12 hours, and there is ibuprofen, painkiller 2 in every 4 hours. Okay, not to exceed 8 per day. It should be more than 8 per day. Okay, that is what we can give an idea regarding this medicine towards the patient. The question is quite easy. So now we will start with, shall I start with the discussion? You all are ready, all of you? So shall we start with the discussion? Okay, this is a known case. We can collect the name of that bystander. Simply we can address the patient as mother. So we are going to deal with the discharge discussions. Okay, we are asking them their knowledge, we are assessing their knowledge, and we are going to help them with this our ideas and discharge instructions. Okay, അപ്പോൾ നമ്മൾ അവരെ ഹെൽപ്പ് ചെയ്യാം. Shall I start? If you're ready, just get me some. Okay, so those are sending me likes, so I'm taking it as a signal for continuing. Okay, Maklai. So how we can give a polite introduction as a pleasing, warm introduction you can give here according to the time. Good morning. So we can collect the name first itself. Good morning, Mr. Joseph. Okay, good morning, Mr. Joseph. Okay, my name is Abhilash. I'm the nurse working with your mother today. Okay. So good morning, Mr. Joseph. I'm Abhilash, or whatever it is your name, you can say like, okay, my name is Dash. Okay, you can tell your name. My name is Abhilash. I'm the nurse. I'll be the nurse working with your mother today. Okay, I will be the nurse working with your mother today. How are you doing? Okay, okay. How is your mother doing? Okay, hope you are well set to go back home. Are you ready? Okay, are you ready to go back home? Okay, I hope you are very happy since your mother's discharge is fixed. Okay, hope you are ready to go back home. Okay, okay. So this is how we are going to politely introduce ourselves first to that polite introduction, a warm introduction we are giving to that patient. Okay, so good morning, Mr. Martin. I'm Abhilash, the nurse working with your mother. How is your mother doing? Is everything going on well? Hope you are very happy going back home. See, your mother's discharge is fixed. I hope you are very happy going back home. Okay, are you all prepared? Okay, are you all set to go back home? Are you all set to go back home? So this is a perfect introduction that you can give, that also create a sort of positivity among our interactions. Okay, so that son will also feel more, or daughter will also feel more comfortable with this mother's health and all. Okay, good morning, Mr. Martin. My name is Abhilash. I'll be the nurse working with your mother today. Okay, how is your mother doing? Is everything going on well? Hope you are all set to go back home. So your mother's discharge has been fixed. I hope you are all set to go back home. Okay, are you all set to go back home? Okay, hope you're happy. All those things that we can explain to the patient okay, we can explain to the patient's bystander, son or daughter, whoever it is. Okay, so they will be saying like, oh nurse, yes, I'm happy going back home, very happy going back home. I can care my mother for another 6 months. I'm very happy, but still I'm totally blank. I really don't know how to take care of my mother's activities, how to make her health activities possible. So I want your help. I want you to explain me all these things. They will be okay, what level of care and how should it be delivered? All those things are still unclear for me. Okay, so how we can say that, yes, I know you are quite anxious, but you don't have to worry about it. Yes, I know you're quite anxious. Okay, nothing to be overly concerned about. All those things, anything you can try, like, yes, I know that must have been quite hard for you. Yes, I know you are quite anxious. There is nothing to be overly concerned about. Okay, I will explain you how to take care of your mother. I will explain you post-discharge care activities so that you can follow that. Okay, so it will serve much helpful for you. Okay, well, I know you are anxious. You don't have to worry. Nothing to be overly concerned about. I will explain you. I will give you detailed description of how to take care of, detailed description of your mother's care activities, both verbal and written instructions I could provide, so that you will feel it more comfortable. Don't worry, relax. Okay, don't worry, stay confident. Okay. Okay, my name is Soumya Narayanan. Hello sir, I am Soumya. Hope you remember me, the one who took your blessings before going to exam. I cleared OET with 4B, sir. Thank you so much. I'll be always grateful for your classes. See, okay. Maklai Soumya, I remember. Okay, I'm very happy that you people are sending me these messages. Actually, it is power booster for all other students. This is a great bliss that I could ever receive. Okay, my good words from my students. I'm very happy that you got 4B. You have excelled in all those 4 modules. I am very happy, Maklai. My prayers, blessings and all the very best for all your future endeavors. I am very happy, Maklai. Soumya, stay blessed. Okay, I wish you all prosperity, all welfare throughout your life, my prayers, and do remember me also in your prayers, Soumya. God bless you, Mane. God bless you, all the best. Okay, so all of you just give a congratulations. You could comment for Soumya. All of you can give some token of appreciation either by your words or by some clap emojis, and you could send your wishes. Okay, Soumya, it is great, Maklai. I am very happy. So you have just motivated all our students, those who are attending or those who are yet to watch our live sessions. God bless you. Okay, so I'm getting some good. I'm more motivated now. Thank you. Yes. Okay, Makala. So the second task, we have come to the second task. Like, yes, I know you are anxious, but you don't have to worry. Okay, I'm here to help you. Nothing to be overly concerned about. I'll give you detailed description on how to take care of your mother so that you will feel more comfortable. Okay, I could give you written and verbal description of your mother's care activities. Relax. Okay, they will be asking like, thank you, nurse. What are all the things that I should do? Well, Mr. Joseph, you have to take a great care during these initial days. Okay. Well, Mr. Martin, you have to take a great care of your mother, especially for first 8 weeks. Well, Mr. Martin, you have to take a great care of your mother. I know you are very caring and very loving and concerned about your mother. Okay, so for first 8 weeks you have to take a great care of your mother. I will explain you what all the things that. Okay, firstly it is medications. Okay, firstly medications. There are non-steroidal anti-inflammatory drugs. There are painkillers. Okay, you have to ensure that your mother is taking the medications as per the doctor's instructions. Make sure that the medications are taken by your mother according to the doctor's instructions. Okay, the prescriptions would be there. Never allow her to skip any of those medications. Okay, it is a must to follow the medication as prescribed. Okay, there are anti-inflammatory medications, painkillers would be there. So it is a must to follow the medication schedule as per the prescription. Never allow her to skip any of those doses. It is a must to complete the course so that you can accelerate the recovery process. Process. Okay, yes, then when it comes to dressing, I know that you are quite worried about dressing. You don't have to be anxious. If you are having any problem with dressing, I could arrange a home health nurse, okay, home nurse to visit to you so that the nurse could assist you in dress changing activities. Otherwise, I'll show you how to carry out dressing. You can change it once in every 2 days. You can change it once in every 2 days. Okay, and do have a close watch over the dressing area or surgical site. Do have a close watch over the surgical area or the dressing area. Make sure, okay, see for any oozing or any redness or any pus or any discoloration. If you notice something unusual or unpleasant, make it inform to the doctor. Okay, kindly, okay, you can bring her back to the medical care center. You can bring her back to us. Okay, if you notice something unusual, get it back to the doctor immediately. Get it back to us, or you can take the medical care facility. You can take the medical care facility. Okay, you can avail the medical care facility. Okay, so that is how we are going to make the patient aware regarding the dressing. Okay, and for her mobility, you can there are certain exercises prescribed for her, simple flexion extension activities. You can assist her in her mobility activities. Initially she has to take rest, but later as the time progresses, you can make her do the exercises as advised. Our physiotherapist will give you more information regarding the exercise activities. Make sure that all her activities are assisted. Okay, make sure that she is assisted at all times for her movements, for her mobility and all. Make sure that she is assisted at all times, because there is compromise in her movements. She may be at risk of falls and injuries. Okay, because her movement is quite compromised. Make sure that she is assisted for all her movements and other activities. Are you getting me, Mr. Joseph? Are you getting me, Mr. Joseph? Okay, and next I want to talk you about her diet and all. Okay, make sure that meals are prepared according to the body's demand. You can give her a well balanced complete diet. You can give her a well balanced complete diet, okay, which is rich in protein and calcium, which is rich in protein and calcium. See, protein helps in tissue repair, calcium helps in bone unification. Okay, dietary chart would be given to you before discharge so that you can plan the meals accordingly. So that you can plan the meals accordingly. Hope you are clear so far. Hope you are clear so far. Any queries, Mr. Joseph? Okay, so feel free to ask. So whatever I'm known as, I am clear. Of course, these are some essential care activities that you should follow for first 8 weeks. Okay, through this you can ensure her faster recovery. Through this you can ensure her faster recovery. Hope you are clear, Mr. Joseph. Hope you are clear, Joseph. So they'll be saying, look, nurse, thank you, nurse, thank you so much, but I'm still, nurse, I don't know, nurse, I will be able to do these things properly. How could I make it happen? How could I make it without any delay or any interruption? What can I do for that? Okay, then തുടർച്ചയായിട്ട് ചെയ്യാൻ ഞാൻ എന്ത് ചെയ്യണം nurse? ഞാൻ വളരെ anxious ആണ്. Well, I know that it is quite hard. Okay, it is quite hard to carry out all these activities all of a sudden. Okay, I know it is quite hard to carry out all these activities all of a sudden. Well, you don't worry. Okay, no worries. Okay, try to set up a routine. Okay, try to set up a routine. You can establish all these activities and try to make it as a routine. Okay, try to establish, you can start this you can establish these activities and try to make it as a routine. Try to make it as a routine so that you will get used to that. Okay, both the patient as well as the carer will get used to that. Okay, so you can establish that, you can start doing this and try to set up a routine. Okay, try to establish this activity. You can start this activities, establish it. You can establish this activities. Okay, try to make it as a routine so that the patient as well as carer will get used to that. Okay, there won't be any confusion or concerns. Yes. And for medication, I know that you are quite confused with medication. I could give you a detailed written prescription for this medication. So, okay, detailed prescription. Okay, or if you are more confused, the pharmacist could organize Webster pack for you. Webster pack, it is a box where the medications are arranged in order according to time and dose. Okay. So, if you are more concerned, if you are overly concerned regarding medications, I could request the pharmacist to get your Webster pack, Webster, W-E-B-S-T-R, Webster pack. It's a tray where the medications will be arranged in order, okay, according to time and dosage. You can follow that, so there won't be any confusion. How does that sound? Does that sound good? Is that an acceptable plan? Oh, great, nurse, please do that. Surely I will do the needful. Surely I will do the needful. We can, okay, and as I told you, it is very important. It is crucial to assist her for all her activities. Okay, it is crucial to assist her. Okay, as I have mentioned before, as I have told, it is crucial to assist her in all her activities. Okay, it is crucial to assist your mother in all her care activities. Okay, never leave her alone. All things, okay, all those things which are needed and necessary should be there in place. Okay, okay, it should be in a close proximity where she could lay her hands upon, where she could lay her hands upon. Okay, all those things which are needed and necessary should be in close proximity, that should be in and around, so that she could lay her hands upon, so that she could lay her hands upon. Make sure that she is assisted at all times, never leave her alone. Okay, so please do remember that, it is very important. I hope you are following. Yes, okay, and it is very essential to wear a surgical boot post discharge. It is very essential to wear a surgical boot post discharge. It is very essential to wear a surgical boot post discharge. Okay. So that patient will be asking, like, nurse, what is that, what is the surgical boot, what can I do for that? Okay, what is the use of the surgical boot? Even the doctor has told me regarding the surgical boot, what should I, okay, if you want question, please do put that question. Okay. So, what is the impact or what is the use of this surgical boot, they will be asking you. So, we can tell the patient like, see, surgical boot is very important, it has to be applied, the surgical boot has to be, your mother, okay, make her wear the surgical boot, it is very important following post discharge. Okay. See, it supports the surgical area, surgical boot, it supports the surgical area, provide comfort to the area. Okay. It provide comfort to the toe area, or it provide comfort while walking or while doing activities, and it will be a pain reliever. Okay. And it will provide easy pain relief. Okay. Surgical boots are very essential following the surgery, post discharge, it is very essential. Make sure that your mother is wearing the surgical boots. Okay. It provides more comfort, it provides more comfort to your foot, and also it relieves pain. Okay. It relieves the bunion pain, it relieves the bunion pain, it relieves the bunion pain. Okay. Bunion surgery, bunion pain. Okay. So, that is what the use of this surgical boot. Okay. This is to ultimately this is to protect your boot. Okay. This is ultimately this is to protect your foot, you can say like that. Okay. It relieves pain, swelling, it provides comfort, and it protects your foot. Okay. Post discharge. Well, Mr. Martin, I appreciate you. I appreciate that. So, when the patient is, the bystander is asking like, nurse, why this boot is very necessary? What is the impact of this boot? I appreciate that. I appreciate your concern, as wearing a surgical boot is very essential post discharge. Make sure that your mother is wearing that. It overall it protects. Okay. Ultimately, it protects your foot. It provides pain relief. Okay. It relieves swelling. Okay, it relieves swelling. Okay, it reduces pain and relieves swelling. Yes. So, it is a it provides relief from bunion pain. It provides relief from bunion pain. It relieves bunion pain. Okay. So, it supports your mother's foot in all the way. Okay. So, make sure that this surgical boot is used by your mother. Okay. Make her use the surgical, make her wear the surgical boots. Okay. That is how we can make. Okay. Nurse, can you just please tell me about this medications, nurse, how it should be taken, nurse, what are all the medications and how it should be taken? Definitely, I will explain it to you. Definitely, I will explain. So, they will be asking more about the medication. So, as if it is given there, you can just give a narration. Okay. Definitely, I could explain it to you. So, there are anti-inflammatory, there will be inflammation because of the surgery, bunion surgery. So, you can take anti-inflammatory drugs. There is naproxen, it is also painkiller as well as it is an anti-inflammatory drug. It has to be given, once in every 12 hours. Okay. It has to be given once in every 12 hours. This medication has to be given once in every 12 hours. See, you will get a detailed prescription, and moreover we will try to get a Webster pack for that. And the another medicine which is given is like ibuprofen. Hope you are well known with that name, ibuprofen. Hope you are well known with the name ibuprofen. It is a painkiller as well as an anti-inflammatory drug. This is also commonly used in this condition. It has to be taken twice in every 4 hours. It has to be taken twice in every 4 hours. Okay. It has to be taken twice every 4 hours. Okay. And make sure that the dose does not exceed more than 8 per day. Make sure that the dose does not exceed, and make sure that the dose does not exceed more than 8 per day. Dose does not exceed more than 8 per day. So, this is what regarding the medications. Okay. And regarding all other supplements and all, we will give a detailed prescription, and as I mentioned, we will try to get you, we will get you a Webster pack, so that all the medications will be arranged in order accordingly. Okay. How does that sound? Hope you are comfortable with that. So, the patient will be saying like, so bystander will be saying like, yes nurse, that sounds great, please do that. Oh, do not worry, your mother is our patient and it is our priority to deal with her. We will definitely make, that even after discharge she is assisted by all means. Okay. Your mother is our patient, it is our priority to deal with her. You can change the question. Okay, it is our priority to, okay, surely we will do the needful. Your mother is our patient. It is our priority to deal with her. It is our priority to deal with her. We'll make it sure that she is assisted by all means. We'll make it sure that she is assisted by all means. We'll make it sure that she is assisted by all means even after the discharge. Okay, she is assisted by all means even after the discharge. You don't have to worry about it. Okay, and feel free to contact if you are in need. And feel free to contact if you are in need. Okay, Mr. Joseph, do you have any more questions for me? Okay, Mr. Joseph, do you have any more questions for me? Okay, is there anything else that I should have a look into? Okay, you would like me to have a look into. Is there anything else that you would like me to have a look into? Is there anything else that you would like me to have a look into? Is there anything else that you would like to ask or discuss? Do you have any more concerns? Okay, is there anything else bothering you? But I'm honest, that was really useful talking to you. Okay, so we can say it was even a pleasure talking to you. More instructions and information will be given at the time of discharge. More instructions and information will be given at the time of discharge, and we will make it sure that all her needs are in place. Okay, we will make it sure that all the services are in place. We will make it sure that all the services are in place. Okay, and feel free to contact whenever you are in need. Okay, now you stay with your mother. I'll speed up the discharge process. Now you stay with your mother. I'll speed up the discharge process. Now you stay with your mother. I'll speed up the discharge process. That should be the perfect conclusion for this particular role play. Now you stay with your mother, make her calm, comfortable, make her relax. I'll speed up the discharge process. So they will be saying a thank you and we will be leaving the space. So that's what the conclusion is. Hope this topic was useful. Okay, those who are watching, just get me some comments. If you are okay, means just get me some comments. I'm very happy with Soumya's comments and Soumya's response. I'm very happy that all my students are watching me. So make sure that you people are referring all this. If you're listening to this, you can write the points, you can make this, make sure that you're using your proper tone, intonation, modulate your intonation, see the question sentence structures, try to apply it in your role plays. You can definitely fetch a very good score if you go for consistent practice. Okay, so my prayers are there with you. All the very best for your future endeavors. Stay tuned. We'll see you next Tuesday. Take care.